Welcome to Part 2 of this lecture series on psychosocial skills. This is Introduction to Psychosocial Referrals for SMD 210. The objectives of this part of the lecture series are to review and apply mental health referral skills. Some may say that a referral, any referral, may be an easy skill. You may simply thumb through a phone book or on the internet and find a mental health care provider or any other type of healthcare provider. And this may be convenient to you, but not necessarily to the individual or your athlete or patient. With a mental health referral, this process is complex and has many variables. Some are obvious and some are hidden. Here we will explore those variables. What is a psychosocial referral? It is a dynamic helping process in which one person, the helper, connects another individual, so the athlete or patient, to a resource that can better assist the individual's life functioning. It's the intentional process of addressing the psychosocial needs of an individual. First, let's recap. When would we refer someone? And what are psychosocial issues? These are situations, influences, and conditions that affect the manner in which a person perceives, receives, and responds mentally to life experiences. The thoughts and feelings can affect an individual in his, her, their life and performance in activities or sport. We will talk more about specific psychosocial issues that would warrant a referral in the future. A referral would occur when an individual is experiencing issues such as distress, discomfort, negative change in functioning, or everyday activities. And these issues can range from mildly uncomfortable to completely debilitating. Either way, an individual may benefit from a referral to a mental health provider. The purpose of a psychosocial referral is to connect the individual with a mental health provider, in which this provider will conduct an evaluation and provide counseling. Counseling is also known as therapy or psychotherapy, and these terms are usually used interchangeably. Therapy is the exploration of the important events in one's life. It's the possible psychological, social, and physical elements that are contributing to an individual's stress. It also will explore the potential thoughts, feelings, and behaviors that lead to life stress. The idea of counseling may be perceived in many different ways to individuals, and in particular to athletes. Sometimes it's perceived as scary, intimidating, irrelevant, questionable, or mysterious. Why do you think that is? Pause the video now and respond on your worksheet. We will discuss this further in class. If you are referring an individual to a mental health provider, you should be able to clearly articulate a basic understanding of psychotherapy. This is possibly the most important task in the referral process. You should be able to clarify the process, as well as encourage the individual, so the patient or athlete, to make a commitment to try out and participate in counseling. The more that you can normalize counseling or therapy to an individual, the more likely that the individual will be willing to try it out. If you can't articulate what therapy or counseling is like, you may have a hard time convincing another individual to go and try it. Therefore, at the very least, you should be educated on what psychotherapy or counseling is all about. Counseling can be viewed as an interaction that an individual shares, just like the relationship with any trusted friend. Both individuals must have confidence and trust in the relationship, and the counselor or therapist should understand that individual's worldview. How did they grow up? How were they raised? How do they view the world? Counseling is four-pronged in its approach. A therapist or counselor will explore with an individual their cognitive, affective, behavioral, and contextual aspects of their lives. They'll explore thoughts, feelings, behaviors, or actions, and the world in which the individual is immersed. Typically, one or more domains are experiencing stress in an individual's life. In counseling, the individual and the therapist will seek to explore those domains and promote wellness. There are over 200 theoretical approaches to counseling, or how a mental health provider conducts their therapy sessions. There certainly are more common approaches, such as cognitive behavioral therapy, or exploring how one's thoughts are affecting behaviors and emotions. But not every approach will work with every individual. Therefore, when referring an individual to therapy, you should have a basic understanding of the mental health provider's approach and inquire whether the mental health provider feels they're a good fit for that individual. This is especially important when considering specialties, such as mental health providers who are experts with eating disorders or anxiety disorders or depression, for example. This is also important to understand their practice so you can communicate the process or the approach of that therapist to the individual who you are referring. There are many different forms of counseling, but we're going to talk about two. Individual counseling is the one-on-one counseling between a counselor or a therapist or psychologist, etc., and a client. This includes talking and exploration, education, problem solving, goal setting, and wellness-focused activities. There's also group work, or the process of giving help or the accomplishment of tasks in a group setting. This is typically formed around a shared purpose, such as alcoholism or eating disorders, and members are providing help to each other. Usually it's led by a trained group leader. It's important to consider that in order for an individual to benefit from counseling, there does not always need to be a specific problem that needs to be fixed. There is a culture-linked belief about counseling that if someone's in counseling or therapy, then something must be wrong. But counseling and therapy is much more than just corrective and problem-focused intervention. There are a wide range of benefits to counseling and referral. The two approaches, though, to counseling are, number one, to fix a problem. So this is the most common approach. It focuses on the problem or pathological remediation, such as the therapeutic process by which counseling procedures are implemented with the goal of correcting or fixing the problem or situation. But there is also a prevention approach to counseling, and this is very much underutilized. This is a therapeutic process used to avoid, avert, or minimize potential problems before they even occur. Next, we'll talk about how to actually provide a referral. Move on to the next video.